And we're just going to start by thinking about what we can feel between our bodies and the floor and where we're feeling connected with the floor. So where we should be feeling it is underneath both feet, underneath the lumbosacral junction, underneath the TL junction, underneath the back of both shoulder blades and underneath the back of the head. And obviously the back of the arms as well will feel it. Okay, so if you're not feeling all those points as connected as they should be, then we're just going to go through some postural cues now to get better connected with the floor. So we'll start with the feet. Think about the feet. Feel whether they're feeling connected equally from side to side. If you feel like you're putting more weight into one side than the other, just push down a little bit more with the other side. You should be feeling it on the inside and outside of each foot equally. So if you're feeling like all the weight shifted onto the outside, just try and pull that medial arch down into connection with the floor, but keeping the outside of the foot connected with the floor as well. And that goes for the same as if you're feeling more connected on the inside, try and get the outer part of the foot connected without lifting the inner part. And then we're going to work our way up to the pelvis, to the lumbosacral junction. And to get better connected there, we're going to start by just tilting the pelvis forwards into an anterior pelvic tilt. And then we're going to rock it backwards into a posterior pelvic tilt. Pull it forwards and back. So we're peeling the spine away from the floor when we anteriorly tilt the pelvis, and reverse peeling as we posteriorly tilt it. So keep doing that movement. And then what we want to do to find a neutral pelvis and a neutral lower back, we're going to just stop in the midpoint between those two end ranges where the back should be flat on the floor. There shouldn't be an arch, you should be able to get your hands underneath your back, and then you shouldn't be caved into the floor either. Okay. So now you should feel better connected between your lumbosacral junction, which is the junction between your lower back and your pelvis. And then we're going to work our way up to our rib cage. So pelvis and rib cage, they want to be parallel with each other. So when they're parallel, it means that they're able to better communicate. So diaphragm and pelvic floor when you're breathing, so you get better activation of the deep core stabilization system. So what can happen is we can, without realizing it, end up in this kind of open book position where we get this extension through the lower back, this rib flaring, and it means that your diaphragm and your pelvis, your pelvic floor, aren't communicating as well. So we want to imagine that your pelvis and your rib cage are like the pages of a book, and obviously the back is the spine, and we're going to try and pull the pages of the book together so that they're now parallel, so you've got a closed book. So you should with that feel better connected with the ground and your body between your TL junction and the floor, so the junction between your upper back and lower back, and your ribs should now feel nice and connected with your pelvic floor and your pelvis. Now we're going to work our way up to the shoulder blades. So again, you should be feeling it equal from side to side, and you should be in a neutral position with your shoulders. So we don't want the shoulders forwards in protraction and internal rotation, and we don't want them elevated. So we want to externally rotate, depress and slightly retract them. We don't want to pull the shoulder blades back towards the floor, because that's into a fully retracted position, because again that's not neutral. Okay, so external rotation, depression and slight retraction. And then working our way up to the head. The head wants to push back down towards the floor, so we don't want to bring the chin towards the chest, so we take the neck into flexion. We don't want to go into neck extension, so we're going to push it right back down towards the floor. We should feel these muscles at the front of the neck activating, looking up towards the ceiling. And then now we should feel better connection between feet, lumbosacral junction, TL junction, shoulder blades and the back of the head. So we're going to work on our breath, put one hand on the chest, one hand on the tummy, and we're really going to focus on our diaphragmatic breathing. So as you breathe in, your diaphragm should go down, and that creates an intra-abdominal pressure the whole way around your abdomen. So as you breathe in, hand on the tummy lifts, hand on the tummy lowers as you breathe out. Hand on the chest doesn't want to move anywhere. Breathe in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. If you find that you're just really struggling to do this, you're breathing up into your chest, do keep practicing it. Don't get frustrated with it. It takes time to retrain this this pattern if you've done it a different way for a long time. But it's really important we do try and create better breathing patterns, because it not only sort of creates that deep stabilisation. If you're breathing up into your chest, you're going to be using your secondary muscles of respiration constantly. They're going to get overworked, they're going to get tight, you're going to end up with neck pain, shoulder pain, headaches. So it's really important, even just getting your breathing right could help correct some of your problems. Okay, put your hands around your waist. Now we've got that breathing in the right order. And what we want to feel as we're breathing in is this activation the whole way around the abdominal wall. So like I say, as you breathe in and the diaphragm goes down, it creates intra-abdominal pressure, 360 degrees of that intra-abdominal pressure. So you want to feel this activation the whole way around. So grab hold around your waist, fingers around the bony bits, back thumbs into the back of the back muscles, and cough. So we want to wake the muscles up, so cough and just activate the muscles, feel those muscles expand, and now try and think about those muscles expanding and lifting the whole way around. So you want to be feeling this front to back equally and symmetrically from side to side. So if you're struggling filling up one area, grab hold of that area, really poke into it, cough again, wake the muscles up, and just really try and concentrate and visualise on those muscles, and then try and coordinate it with the rest of the abdominal wall. So keep doing that. So when you're trying to retrain your breathing patterns, this is probably the easiest position to retrain that in. This and the 3-month supine with the legs in the air, probably with your legs supported at first, so on a ball or on the sofa. But you can do this in any position, so you can do it sitting, standing. So whatever you're doing during the day, whether you're sat watching TV or you're in the car, like I find being in the car the perfect time to practice this, especially when you're stuck in traffic, because you can put your hands around your waist, grab hold, try and wake those muscles up. I used to get a lot of back pain on my right hand side. I think I've mentioned it before. I don't inflate as well on the right hand side, it's a bit delayed. I probably didn't used to do it properly at all. in the past, and so I used to get a lot of right side and lower back pain, particularly when I sit in the car for sort of any length longer than about 20 minutes. But this has been a real game changer for me, even just focusing on my breath when I'm in the car, working on my posture, sitting upright, making sure that I've got my rib and pelvis connection, and breathing into my abdominal wall the whole way around has given me a lot of relief when driving. And I've done a few sort of, not recently, but in the sort of like last 6 months before all this happened, a couple of drives, 2-3 hour drives to see friends, and I've not had a single like incidence of back pain because of this. Okay, so now we've got the breathing, the 360-degree breath. We want to know how to brace. So when we're doing things day to day that need more stabilisation, you need to know how to stabilise a bit more. So you'll need to create a brace, and then obviously the amount of brace that you need depends on what the weight is that you're lifting, or the difficulty of what it is you're doing. So to do that, what you don't want to do is pull your belly button in or clench or tense your tummy. It's an outward push, so you breathe in 360 degrees, and then you create this outward push by like I always say, imagine that you're farting. So breathe in 360 degrees, and then an outward push, imagine you're farting, and carry on breathing. Keep those muscles active as you're breathing in and out. Do another couple more breaths. Okay, now we're going to start the flow. So we're going to start as we always start. We're just going to float one leg up into the air and lower. Floating the other leg up and lower. So remember, this flow is all about the hip and lower back, so focusing on keeping the lower back in a neutral position, pelvis in a neutral position as we're lifting the legs, and this movement is just coming from the hip. As we're lifting the leg into flexion, or the hip into flexion, slightly externally rotate your hip as you're doing it. And then as you're lowering, slightly internally rotate. And then now we're going to lift both legs up at the same time. So we're going to create our 360-degree breath and our brace and lift the legs up. So that little bit of a brace is important because it helps to stop us from losing our pelvis. So if you've not got your core active, you're likely to just go into this anterior tilt. The hip flexors will take over and pull the pelvis into this anterior tilt, and you'll lose it in the lower back. So by creating that extra bit of brace, you can hold your pelvis in a better position. And we're just flexing and extending the hips. Okay, do a couple more. And then hold it in the 3-month supine position. So feet neutral in slight dorsiflexion, feet higher than the knees, knees over the hips, hips in external rotation. And then we're just going to do some toe taps with the feet in the air. And some double toe taps again. Movement just coming from the hip. I'll take one leg into hip extension and knee flexion. Again, keeping the lower back flat on the floor. Don't let the lower back lift into extension. Try not to let your tummy muscles tense. So we're still creating our 360 degree of diaphragmatic breathing. Tummy muscles shouldn't be clenched or like struggling. You should have a nice smooth cylinder around your abdominal wall. So if you are getting to the point where you're tensing and clenching, just drop it back a bit, have a little rest, bring your knees in, bring one foot down to the floor. What we don't want is to over recruit the wrong muscles. So extending. And then if you can, bring in a double hip extension. But only if you can do it without lifting lower back off the floor and pelvis tilting anterior. Just going to do one more. This is a difficult one, that one. Bring your knees into your chest, give your hip flexors a little bit of a rest. Got the wrong top on, it's little knots digging in my back. Okay, so we're just going to hold in a 3-month supine position. Just focusing our breath into our backs. Couple more breaths. And then we're going to lift the feet a bit higher into this 6-month supine. So we're going to grab hold of the feet are pointing up towards the ceiling. If you can't do this without being all scrunched up like this, grab hold of a TheraBand and put it around your feet and hold that position. And we're just going to hold this position, focusing on our breath into our back. This is a really nice way, if your muscles are feeling really tight in your back, this will just relax them. Another couple of breaths. Feet back into 3-month supine. And this is where we're going to change up the roll a little bit. So this is Niam's idea. So we're going to take our hands into the sky again. Lift your head slightly, look to the way you're going. And it's all the things are still the same, so pelvis and shoulders come at the same time. So imagine you've got your Lego body, we're rolling the body at the same time. We land with this little gap here because we're keeping a straight spine, not a banana spine, and it's a controlled movement, so you're not just flopping. So we're going to come onto our sides, and then as we go back, we're going to extend one leg. So we'll extend the leg of the side that we've just rolled. Bring that back, and then we're going to roll onto the opposite side and then come back, extend that hip, roll onto the other side. So top hand reaches as if you're going to be trying to like move towards something. Roll back, extend, left hip. If you've just rolled to the left, roll to the right, and roll back, extend the right hip, roll left, roll back, extend left hip, roll, roll back, right hip, and then on this next one we're going to roll and we're going to extend the left hip, flex the right shoulder, roll, roll back, extend the right hip, flex the left shoulder. When we're taking the shoulders above the head, make sure the ribs and pelvis stay parallel. You don't want to go into that rib flare as you're bringing the arm over, so just go as far as you feel before you start your ribs flaring. Roll, left arm, leg, right arm, roll, nice and controlled. Right leg, left arm, getting my words all mixed up, roll. Let's do one more. Okay, so we're now going to roll onto our side and up into our lower oblique sit. So this is a bit of a different one as well. So we're going to go up into our high oblique sit, roll, twist the knees up to the sky into the tall sit, down to our right side, high oblique sit, low oblique sit, onto our side, back up, low oblique sit, high oblique sit, twist, tall sit, twist round, high oblique sit, low oblique sit, onto our side, come up, and we're just going to repeat that from side to side. Make sure when you come up into your tall sit, you're in this nice straight spine, you're not flexed like this. So keep doing that movement, so twisting round, high oblique sit, low oblique sit, onto your side, up, and twist the hips, down, do one more each side. Okay, and you're going to finish off up in this oblique sit, and we're just going to hinge the hip and we're going to lift. So your hinge, lift and lower, really slow and controlled through that lower butt cheek, lift, lower, lift, and then we're just going to lift and twist. So if your left bum is down on the floor and you're lifting with that left bum, you're going to twist to the left and lower. Lift and twist. Lift and twist. And then next one, we're going to lift, twist, pull that right leg round, and we're going to be going into our tripod. So hands down flat on the floor, Try and get your back nice and flat if you can. And we're just going to lower backwards. We're hinging backwards and forwards. Keep the hands flat on the floor. Keep trying to lengthen through the spine. Keep the foot in connection with the floor as well. Let's do one more. And then we're gonna come into this high kneel, curl the back foot under and swap the legs round, down into your opposite tripod, and then hinge backwards. Keeping that back as flat and straight as you can, foot connected with the floor, hands flat on the floor, hinging backwards. One, and then you'll come up into the high kneel, and then we'll pull this left leg back round, and then we'll lower back down, and we'll do some lifts again. So hinge and lift, this time using the right glute or right group of butt muscles. Hinging up and down. And then we're going to add in a twist. So twist to the right this time. Twist. Twist. And then this next one we're going to twist and pull the leg through again. So pull that left leg through. And then, so I'm going to do something a little bit different again. It's going to have to be a little bit slow because I have not got great balance and I'll probably end up falling over. So I don't want to do that again like I've done in the past. So we're going to go from this high kneel, and we need to make sure that the pelvis stays level with the floor. Try not to let that hip hike on the side where the foot's forwards. Try not to be too narrow with the foot, so bring it out to the side. And we're going to be going from hinge, curl the back foot under, stand, and back down into high kneel, hinge. So, bit of a brain boggle. As you're coming into your stand, so you're going to curl the back foot under, bring that leg up and try and get the foot into a bit of dorsiflexion, and then pull it back down. So yeah, this is a challenge for me. Right, so let's go. So pelvis level with the floor, hinge backwards, come up into high kneel, curl the back foot under, make sure the pelvis is level, shift the weight, come up, take that foot up and back down. And as you're coming down, try and keep the pelvis level, and then we're going to hinge backwards again. And then come up, curl the back foot under, and try and lift. Woo. It's definitely going to test your balance, this one. Hinge back. And up. Curl the back foot, pelvis level, lean forwards, up, back. Try not to fall over. hinge, up. Last time, curl the back foot under, lean forwards, up, ooh, and then back down. I definitely need practice with this one. So now we're gonna lift up again, go to the other direction, and we're gonna do the same. So right foot forwards this time. Try and keep the pelvis level. So this could get interesting because this is my worst side. So we're gonna hinge backwards, come up, curl the back foot under, pelvis level with the floor, stand and lift the foot, back down, lower, hinge, up, curl the back foot, pelvis level, shift forwards, bring that left leg up. I'm actually doing better with this side today. Pelvis level, hinge, up, pelvis level, back foot under, shift the weight over that front knee, foot up, back down, hinge. Last time, pelvis level, curl the back foot, shift forwards and back down, and then bring this leg back, lower down, and we're going to do some lifts, lift, lift, lift and twist, twist into it, twist, twist, last one, and pull the right leg round, hands down into tripod, pull, curl the left foot under, pull the right foot back, and we're into bear. And so we're just gonna now, we're gonna turn to the left, sweep the left leg under, and then pull it back, turn to the right, or you actually turn into the left but you're putting the weight on the right, sweep the right leg under, pull that leg back in, and through. And we're going to alternate between those two, trying to keep the body controlled, so shoulders, pelvis moving as one again. Hand flat on the floor, try not to let the fingers claw up. And then finish off in bear, knees down, feet down, down into low quadruped. So I'll turn this way so you can see me, but I might go back in that direction in a second. We're going to first of all come down, bring our hands around our waist, heads on the floor, and we're just going to focus on our breath again. Trying to fill out the abdominal wall. Try and breathe into your back. Couple more breaths. Back into low quadruped. So we're now going to do our quadruped rock. So we find our neutral pelvis first, so tilt the pelvis backwards and forwards. Find the midpoint between the end ranges. Shoulders active, so push the floor away. External rotation depression with the shoulder blades. Tuck the chin so your head's pushed back towards the ceiling. And then we're just going to work on, first of all, getting our thoracic extension. So try and come from a flexed thoracic spine into an extension of the thoracic spine without going into lumbar extension. So we basically want to keep that neutral spine position and find the neutral and then pull the upper back into extension without going into lumbar extension. So if you feel that you've gone into lumbar extension by pulling the upper back down, just keep the upper back where it is, or try to, and then pull the pelvis slightly posterior into a posterior pelvic tilt and get your neutral spine again. So now we're going to hinge backwards, hinging at the hip, not at the lower back. Trying to keep the upper back flat. Get that hinge in the hip. Go into as much flexion as you can. So get your knees out a little bit as well so they're not too narrow, because we need some external rotation in the hip to be able to flex back this far. And if your knees are too narrow, you're not going to have that, and you're not going to be able to get back as far without rounding your lower back. And then come forwards. And you're just going to go backwards and forwards, trying to keep that neutral spine position, neutral pelvis. Don't let your pelvis tilt forwards or backwards. Trying to teach that hip dissociation from pelvis and lower back. And then we're going to push down into the floor with the forearms, curl the back feet under, keep this neutral position in the spine, lift the bum in the air and lower. Lift and lower. Lift, lower, lift, lower. Do one more. Lower. And then we're just going to stay in that position, and you're just going to extend one elbow and rotate up towards the ceiling. So if you're extending your right elbow, your right shoulder is going to lift and your body's going to twist to the right, look towards the ceiling. Lower that down. Do the same on the other side. Keep alternating. Just heard a nice little click in my back. Nice little adjustment. Let's do a couple more. And then we're gonna push ourselves up and down. Up, all the while, nothing is happening in the lower back and pelvis. And up into quadruped. So we'll find neutral spine again, shoulders active, upper back in extension without losing the lower back. And again, we're going to hinge backwards into as much hip flexion as you can, making sure we don't round into lumbar flexion as we go and go into extension as we go forwards. and backwards. Most of this movement is hip and knee. And obviously in the shoulders as well. Okay. So now I'm just going to turn this way. So we're going to do some hip rotation. So we need a really good stable base. So if we're moving the right hip, we're going to transfer the weight into the right hand and the left knee. So the body stays still. You've got this counterbalance, so you can move this leg without really anything happening in the body. And then if you're doing the left leg, you're going to put the weight into the left hand, right knee, because we don't want to be shifting all over the place. Pelvis doesn't want to be dropping. So you need to create your 360-degree breath as well. So what we're going to be doing is you're going to keep the knee bent, lift the right leg up into hip into extension, take the leg out to the side into abduction and external rotation, and then pull it in to flexion, and then back into extension. When you're doing it, you don't want to go into this lumbar extension. So the lower back stays neutral, and you just want the hip to extend, not the lower back to extend. So I'm going to do my left side now. So transfer the weight into left hand, right knee. Take the left leg into extension, out into abduction, external rotation, into flexion. And do the opposite side. Hip extension, external rotation, abduction, into flexion. Back into the middle. And we're just going to alternate sides. Keep alternating your sides. Nice controlled movement through the hip. Do one more each side. Okay, give your arms a little bit of a shake because we're going to be going into bear, and bear is a tough one. So we're going to be doing bear, and we're going to be doing those same hip rotations that we just did in quadruped. If you find the bear too hard for this, just go back into your quadruped and do the same. So again, before you go into bear, find your neutral, pull your upper back into extension, and then lift. Don't lift and let the pelvis tilt forwards. So pelvis stays still, lift, and then we're going to take one leg back, out to the side, into flexion, and down. Other leg, out, in, down. Alternate. Rest whenever you need to. I'm just going to do one more on each side. Go down, shake your arms off. Then we're going to go up into bear again. And we're going to hinge again. So we're hinging the hip, hinge, hinge, hinge. So movement's trying to come from the hip only. And then walk the hands backwards into your squat. Okay, so be nice and upright in the squat. And then we're just gonna twist round. So one leg goes forwards, the other one stays in that squat position, and we're just gonna stretch the hips out. Come here. And then twist back round into your squat. Try and be nice and upright when you get back into the squat. Twist round again. And then, so we're going to alternate sides. Back round to squat. Do one more each side. Walk your hands back out. Shake your legs off. Reset. Find your neutral. I'm just gonna come this way. So, find your neutral, upper back nice and flat, curl your back feet under, lift your bum, hinge, backwards, into your, so walk the hands backwards, into your upright squat, and stand, and down, and stand, and down, stand, down, and then last little bit, again, don't know why I've decided to do this because it's single leg again and I'm rubbish with single leg. So we're gonna get the weight onto one foot, lift the opposite leg, foot in dorsiflexion, try and get the hip and knee at 90, take the leg out to the side, so you've got this movement in the hip, touch the floor with the toe, bring the leg back up, pull the leg in and down. I forgot to bring my foot into dorsiflexion then. Bring the foot up, out, point the foot, bring it back up, pull it into dorsiflexion, back round, down. So we'll do 2 more on each side. So pull the foot up, out to the side, point, touch the floor, pull the foot into dorsiflexion, up, down. Up, round, down. 1 more each side. Out, point, up, in, down. Last one. Up, out,